In this video, I'm going to demonstrate dry needling to the wider hip area, focusing on the hip abductors and external rotators. So the muscles we're going to needle into include the tensor fascia lata, otherwise known as TFL, gluteus medius, along with gluteus maximus. We're then also going to come through the iliotibial band, aiming for the vastus lateralis. So these techniques are really useful for clients that might have restricted movement around the wider hip area. Also, if they've got generalized hip pain, or they might be suffering from conditions such as runner's knee. Because quite often with the conditions such as runner's knee, although the client will be feeling that irritation and pain on the lateral side of the knee, it's actually coming from the hip, because sometimes that iliotibial band can get tight because there's tension in the muscles that attach into it. And the muscles that come into the iliotibial band include the TFL, gluteus medius and gluteus maximus. They all come in to form that strong fascia that separates the anterior and posterior compartments of the lower limb, which is otherwise known as that iliotibial band. Okay, if we're needling just to the iliotibial band, we're not going to have any effect on reducing that muscle tension that comes into it. So in order to reduce pain here that might be being caused because of friction and tension in this band here, we have to come into the muscles that attach into it. So this needling technique can be really useful for helping to reduce muscular tension in these key muscles which abduct and externally rotate the hip, along with helping to increase range of motion around the hip joint. We would accompany this technique with wider needling, possibly to the quadriceps group and to the hamstrings group as well, because they also are involved in that action of hip movement. Okay, so we're going to sterilise the area first. Okay, so making sure that we're sterilising the hands and just wiping the skin either with a sterile wipe or using the antibacterial. Our first area for the needle is just going to be above that greater trochanter. So in this side-lying position, it's a really nice way to identify where the greater trochanter is, which is that bony protrusion at the lateral side of the hip. The needles, these are larger muscle groups, so I'm going to be using 40mm needles. These are the classic plus needles that I'm using, and they're 40mm in length and 0.25 in width. Okay, so I'm going to prepare these guided needles, these sterile guided needles, and I'm just taking that stopper out. I've identified where the greater trochanter is here, so that's our landmark. And we're going to place our first needle about 1.5 to 2 inches above that greater trochanter, and we're going to use that perpendicular movement. So I've placed the tube onto the skin, I've pressed the needle into the tissue, and then from here I'm then pressing that needle down roughly about halfway. If your client has got good muscle tone, then we could go slightly further than halfway with that needle. The next needle going in is going to be more into that common trigger point area on TFL. So again, we can identify where the greater trochanter is. We can see nicely on the client where her TFL is. And in the front of that anterior aspect of TFL, we often find that common trigger point. So again, I'm going to use that perpendicular motion for the needle, pressing in, lifting the tube off, and coming into that muscle tissue. The next needle is going to be aiming for glute med. Okay, so this is posterior. So our first needle we can see here. Okay, my third needle is going to come about 2 inches behind that and slightly higher up. And then our next needle is going to be aimed at common trigger point in the middle of gluteus maximus. We know that we can develop trigger points anywhere, but if we palpate for the common trigger point area, which is roughly in the middle of gluteus maximus, we can use that first, and then we can be guided by our feedback and through our palpation skills to identify exactly where that trigger point is on our client. So this is coming into gluteus maximus. And then before we start the activation of these needles, we're now going to come into the iliotibial band, but although we're coming through the band here, we're aiming for the trigger points underneath the band, which are in the vastus lateralis muscle. So quite commonly, if this band becomes tightened because of tension in the muscles that come into it, we can then create more friction between the band and the underlying structure, which is your vastus lateralis. And then that friction can then lead to the development of trigger points or hypertonic tissue. So through palpation, we're going to identify where they are presenting, and I'm going to place my first needle here. If we see any obvious blood vessels, we're just going to avoid placing the needle directly into the blood vessel. And again, these are 40mm needles. And I'm going to place one more here because Katie has got quite a bit of tension just there. Excellent, okay. And then if our client was suffering with a condition such as runner's knee and they did have pain as that iliotibial band came down, we could also place another needle a little bit closer towards the knee. As the muscle tissue and all of the wider tissues get smaller as they come nearer to the knee, I would then use a slightly smaller needle. So I'm going to use a 25 here just to demonstrate how we might needle closer to the knee joint. So then once these needles are in, we're making sure that the clothing isn't interfering with any of these needles or the towels aren't interfering with any of them. Then what we're going to do is start our activation based on the feedback from our client. So I'm going to flick first because our flicking activation technique is a bit lighter than some of our other techniques. Then the next activation technique that we would do is our turning technique. Again, this is a light activation technique. And then again, if our client wasn't feeling any sensation and we weren't getting any obvious twitch or any obvious erythema coming off any of these needles, we might then move to the peppering technique. And the peppering technique, again, supporting the client, we're going to lift the needle up towards the tip and then press down again about halfway. And we'd gradually go through activating these needles, ideally in the order that they were inserted. Okay, making sure that you're also supporting the client just in case they get a strong twitch from any of those needles. If the client does get a twitch, then that's great because we know that we have led to rapid depolarization within those muscle fibers, and that helps to release that tension that's caught up in the muscle fibers. So that's our demonstration of dry needling to the wider hip area, focusing on TFL, glute med and glute max, along with the underlying structures under the iliotibial band.